All right, so today we're really getting into it, something super important.
It should be interesting.
We're taking a deep dive into intracerebral hemorrhage, or ICH for short. We got some research sent in about it, an article from Continuum, that journal. And we're going to break it down, all the key stuff.
Good timing, too, honestly. ICH, even knowing the basics, can make a real difference, if you're ever dealing with it.
Right, totally. So before we go too deep, can you give us the basic explanation? What is an intracerebral hemorrhage, if you had to explain it simply?
Basically, it's bleeding,
Yeah.
but inside the brain itself, not around it, like you hear with subdural hematoma. That's different. This is in the brain tissue.
So brain bleed, that's what we're talking about.
Exactly. And it's more common than people think. Second most common type of stroke, actually.
Oh, wow, I didn't realize it was that common. Now, the article mentioned types of ICH. What's that all about?
So two main categories,
Mm.
primary, and then there's secondary ICH. Primary, straightforward, the bleeding is the main problem. Usually from blood vessels in the brain, they weaken.
And why do they weaken? Just wear and tear?
Can be, especially as we age, right? But things like if you've had high blood pressure for a long time, that's tough on vessels. Or there's amyloid angiopathy, that's proteins building up in the vessel walls until...
Oh, so they kind of get clogged up and burst.
Yeah.
Like a pipe.
Perfect analogy. Now, secondary ICH, that's a little different. There's something else going on. That's the cause of the bleed.
So the bleeding is like a symptom of another problem.
Exactly. Like aneurysms, those bulges in blood vessels with those ruptures, or even some infections can lead to it, believe it or not.
That's scary. Makes you realize this is complicated stuff.
Oh, for sure. And it's not just the causes either. The research talks about, who's most at risk, and it's not equal.
Like what? What do they say?
Well, Black individuals, much higher risk of ICH than other groups. And that's not just medical. That's a whole societal issue,
Yeah, for sure. It's those bigger health disparities.
Exactly. And it's not just race either. Women, they're disproportionately affected too. When they go through menopause or if there were complications during pregnancy, that can increase risk later.
Wow, it's wild how connected everything is. You wouldn't think pregnancy complications could impact brain health so much later.
It's a lot to think about. Really shows that ICH isn't just one thing. It's a whole bunch of factors. How it happens, how you recover, all that.
Okay, so let's say someone does have an ICH. Then what? How do doctors even diagnose and treat that? It's so serious.
Speed is key. That's what this article really stressed. CT scan, right away. That's essential.
So they can see the bleed itself.
Exactly. Where is it? How big is it? That determines everything. Then controlling blood pressure becomes really important.
Makes sense. Try to stop it getting worse.
Right. But even then there's debate. How fast do you lower it? To what level? You go too fast, you cause more problems. It's a balance.
So it's not as simple as bring the blood pressure down, huh?
Nope. It's very specific to each patient. And speaking of which, they talk about reversal agents for blood thinners.
Oh, right, because if you're already bleeding, thinning the blood more is bad.
Precisely. So if they think the blood thinners might be contributing to it, they can use those agents to sort of reverse the effects.
Yeah. That's incredible, hitting the brakes on the blood thinning. So it's all about being really quick and strategic.
You got it. And sometimes that means even more intense stuff.
Like what?
Well, sometimes they need to, drain the fluid building up in the brain, usually with something called an external ventricular drain, reduces pressure.
That sounds pretty intense. Do they ever actually remove part of the bleed itself?
They do, but it's not always the answer. When surgery is the best choice, that's still being researched when it truly helps.
Not one size fits all.
Nope, each case is different. Lots to think about. But one thing's for sure, managing ICH, it's complicated and it's changing all the time.
This is already a lot, but so interesting. Anything else from the research that really stood out? Something our listeners should know for sure?
There's this whole other layer we haven't gotten to.
Oh, what's that?
Prognostic scores.
Prognostic scores. What are those?
Basically, it's how doctors try to predict how ICH will turn out.
Oh, so will someone recover? That kind of thing?
Kind of, yeah. But it's not simple. And that is a perfect place to pause for now. We'll get into those schools next time, what they really mean.
Sounds like a lot to unpack. All right, everyone, we'll be back with part 2 of this deep dive on intracerebral hemorrhage. Don't go anywhere.
All right, so last time we were talking about these prognostic scores for ICH. Honestly, kind of intimidating trying to predict the future like that.
Yeah, I get that. It's a lot thinking about brain bleeds and then trying to guess what'll happen. But these scores, they're more like tools, not like a crystal ball or something.
Okay, I like that. Tools to understand what might happen. Exactly.
Yeah.
So they take all that stuff we discussed, right? Patient's age, how big the bleed is, other medical stuff they've got going on, and it helps organize it, see what the outcome could be.
So instead of saying every case is different, it gives them more to go on.
Exactly. And that's huge for making decisions, especially right after it happens. Every second counts then.
Now, the article mentions several different scores. Are they all doing the same thing, or are some better for different things?
Good question. And it's important. Not all scores are equal, just like any tool. Some are better for certain jobs.
So no magic score. That's always right.
I wish. But yeah, the article, it actually compares some of the most popular ones. One is called the ICH score. Simple, right?
Straight to the point.
Been around a while, though, and it's known for being easy to use. Doctors can literally calculate it right there, just from examining the patient and looking at the CT.
No crazy math or anything.
Nope. And that's huge when you're talking about those first few minutes. Got to act fast. So the ICH score, it looks at things like their Glasgow Coma Scale score.
Yeah.
That's how conscious they are, basically. Then how big the bleed is, and whether it's above or below this part of the brain, the tentorium cerebelli.
Okay, starting to get a picture, but you said limitations?
Right. It's good, don't get me wrong,
Yeah.
but it mostly predicts mortality. Like, how likely are they to die from this ICH, not overall. Doesn't tell you much about their life if they do survive.
So not the whole picture of recovery, just if they make it or not.
Exactly. And something else it doesn't factor in if they take someone off life support, That can change things, and the score doesn't know that.
Yeah. Tough to predict every scenario.
For sure.
Yeah.
Now, another score they talk about is the IGS, or intracerebral hemorrhage grading scale. This one's more involved than the ICH score. They made it because of those limitations, like that life support issue.
Oh, so they tried to fix that.
Exactly.
Yeah.
The IGS, it looks at mortality, sure, but also if someone's going to have a good outcome after 30 days.
So not just alive, but like actually doing okay.
Precisely. More about recovery overall.
Okay, so 2 scores, 2 slightly different goals.
Exactly. And there are even more out there. But the main thing is, they help doctors make the best call, both for right now and for the long run.
Like having different lenses to look at the same problem, kinda.
I like that. Getting as much info as possible, then you can decide on treatment and all that.
So much good stuff here, but a lot to take in, even for me. What about our listener? What's the big takeaway with these scores?
Oh, that's a good question to bring it back around. I think the main thing is, even with all these fancy scores, we can't perfectly predict ICH.
There's still a lot we don't know.
For sure. But it gives us something to work with, Understand the possibilities, the risks, and have those tough talks about what the future might hold, make decisions together.
Like you said, tools, not fortune telling.
Exactly. And speaking of tools, there's this other part of ICH that we got to talk about. It's huge. Palliative care.
Palliative care, is like end of life, right?
That's what people think. But it's not the whole story. It's really about making life better for anyone with a serious illness, no matter what the prognosis is, what the scores say.
So it's about managing the symptoms, the emotional side of things, helping people through what's got to be a really tough time no matter what.
You got it. And the research, it actually talks about how important this is becoming for ICH specifically.
Oh, really? So it's not just for the final stages anymore.
Exactly.
Yeah.
It's about talking honestly with patients and families, what they want, what matters most.
So it's giving them control, even when the diagnosis is scary.
Exactly. And sometimes that means the best thing isn't more procedures and meds. It's about being comfortable, having dignity, that kind of quality of life.
This has given me a lot to think about. It's easy to forget there's a person behind all this, The diagnosis, the stats, the scores. There's someone living through it.
So true. That human side of it, never forget that, especially with something as big as ICH.
All right, so we're back and ready to really get into this last part of our ICH deep dive.
Should be good.
We've covered so much, the different bleed types, those prognostic scores. But now I'm curious about, what happens after someone's had an ICH, now what? What's the recovery actually like?
That's such a good question because people don't always talk about that part.
Right. It's not just about surviving the bleed. It's what life is like after.
Exactly. And honestly, recovery, it can be just as unpredictable as the ICH itself was.
So you can't say how long it'll take. Everyone's different.
Exactly. Every brain is different. Where the bleed happened is different. And on top of that, everyone is different. So, yeah, unique journey.
Makes sense, but also makes it hard to know what to expect.
It really does.
Yeah.
That's why it's so important to, Understand the challenges, but also what's possible. Go in with your eyes open. There'll be good days, bad days, all of it.
So, what are some of those challenges? What might someone face recovering from this?
Well, one of the most common is physical disability. Like, depending on how bad the bleed was, where it happened, someone might have weakness, even paralysis on one side of their body.
Oh, so it's like having a stroke, some of the same effects.
Exactly, because remember, ICH is a type of stroke. So those long-term things, they're similar.
Makes sense. And I bet that impacts everything, how you move, just doing normal stuff around the house.
Absolutely. Huge impact on daily life.
Hmm.
And it's not just physical either. A lot of people, they have cognitive difficulties afterwards too.
Like what kind of things? Memory problems, that sort of thing.
Yeah, memory, paying attention, even using language can become difficult. And that can be so frustrating. For the person and their family, it's isolating.
And I imagine all of that, the physical and the mental stuff, it's got to be hard emotionally too.
It really is. Anxiety, depression, even grief, that's normal. Because life's different now. Adjusting to that is huge.
So it's not just the brain healing, it's the whole person.
Perfectly said.
Ah,
And that's where that whole person care comes in, like we talked
right.
about before.
Right, not just meds and therapy, but the emotional support, connecting them to resources, just helping them figure out this new life.
Exactly. And that help, it can come from so many places, right? Doctors, therapists, support groups, friends, family.
It takes a village, like they say.
It really does. And the research even said that social support, it makes a huge difference. People who've got that network, they tend to do better overall.
That's good to hear. At least there's hope.
Oh, absolutely.
Hmm.
That's something I really want people to hear. Recovery might be tough, but it's possible. With the right support, people can be independent again, find things they enjoy. They can still have a good life.
That's powerful. It's a good reminder that, yeah, ICH is serious, but it doesn't have to be the end of the story.
Exactly. It's about adapting, finding that resilience,
Hmm.
and finding the good stuff, even when things are hard.
Love that. This whole deep dive has been so informative. I've learned a lot. Any final thoughts for our listener as we wrap up here?
If I had to pick one thing for them to remember, it's that knowledge is power. Seriously. The more you understand ICH, the better you can advocate for yourself, for your family. You can deal with doctors, make good decisions. It makes a difference.
Couldn't agree more. And on that note, we'll wrap up this deep dive on intracerebral hemorrhage. We really hope this has been helpful, giving you some things to think about,
Absolutely. Thanks for having me.
as always. And to our listener, thank you for being here, for joining us on this. We'll catch you next time for another deep dive into something interesting. Until then, keep asking those questions, keep learning, and we'll see you around.